be first to answer this next question?
Sure.
Rising healthcare costs are taking their toll on big business, Main Street business, the 47 million Americans that lack health insurance, and the unknown number of Americans who are underinsured. What legislation would you support that would make healthcare affordable to all Americans?
Well, once again, I want to go back to last session because we did some good work last session in the area of healthcare. We fully funded the Children's Health Insurance Program, which helps get kids insured, which I think is critically important, and it's a good program. It was a program that was first established by Mark O'Keefe. I'll try to talk a little louder, I'm sorry. It was a program that was first established by Mark O'Keefe back in '99. We finally got it fully funded last session. We did some stuff with tax credits to help small businesses afford health insurance. We did some stuff with pooling of small businesses so they can pool their resources to be able to get health insurance. What we've got is a situation right now in the United States. In Montana, we've got 1 in 5 people without health insurance, and we've got a significant more that have a deductible so high that they really don't have health insurance except in catastrophic situations. So what we need to do in this country is address what's going on. 20% to 30% of our healthcare dollar is going for administration. That as a basis can be ended up with some standardization of forms and some pools by which we can take our medical documents so that all hospitals can get to them so you don't have to have duplicative x-rays and things like that. But the truth is, in the end, we've got to have a medical program in this country that's affordable, that has cost controls, where choice is maintained for both doctors and hospitals, and where prevention is a critical component. All of our solutions need to be on the table, every one of them, because we're losing businesses and we're driving families into poverty. A lot of families in this state right now are one medical emergency away from bankruptcy. We've got to address this problem. It's a key problem, maybe the #1 problem that faces Montana today. But the fact is, we lay down the parameters, we all work together, and we get the job done, and that's what has to happen.
Right on. Senator Burns.
That's a great question. #1, centralized medical records. #2, we have a bill in the Senate that's passed the House called the Small Business Health Plans. It allows small businesses in Montana to pool with businesses across the country to increase that pool and to lower your cost of insurance. Guess who's blocking it? Democrats. Democrats are blocking it. Democrats are blocking it. We've even got a little bill up there that says we'd kind of like to put a cap on malpractice that drives the cost of health insurance. I've got a daughter that's a doc.
What's your writer on this bill?
There's no writer. Anyway, but it's all being blocked by the Democrats. Mr. Reid has decided that he wants to kill this thing too. But I'll tell you what, it's the #1 issue among the small businesses in Montana. We passed a Part D Medicare prescription bill. I'm proud of that. And I'll tell you why I'm proud of it. For the first time, low-income seniors do not have to make the decision on which to pay their rent, their food, or their utilities and still get their medicine. And they're getting it. And their premiums are out like nothing. And they will get it for the rest of their life. Even their wellness drugs. That's pretty important. For years, the Democrats said that they were going to give you that. It was Republicans that did it.
Mr. Tester, rebuttal.
Are you done? Is it done? Okay. Where to start? Let's start with Medicare Part D. We've got a program that was written by the prescription drug companies. It helps some folks, but there's a lot of folks it doesn't help. And if we're going to have a prescription drug benefit for our low-income elderly or our elderly overall, the folks who help make it possible for us to be here today, then we ought to give them a benefit that's a real benefit. Not a benefit that costs so much a month, that drives prescription drug costs up by 30 to 50%, that after you hit $2,250 of prescription drug costs, it disappears, but you still pay the premium, up to $5,100. It's very complicated. My mom's 86 years old. She would have been here today, but she couldn't make the trip. She's sharp as a tack. She couldn't understand Medicare Part D. She didn't sign up for it. And that's the problem. Let's have government work for the people. Let's make sure we have things that are simple so people can understand them. They don't have to go to their attorney or their pharmacist to figure out what's going on.
Senator Burns?
With your plan, you'd have nothing. It's not a perfect bill. It's not a perfect bill. I will grant you that. But we'll make it a perfect bill because it is a humongous bill. It doesn't make any difference. But what we have now is that we've got low income. Now, I will give you an example. A man was taking an experimental drug for cancer. When it comes off of experimentation, goes into the market, it costs $4,000 a month. $4,000. Whatever. $4,000. $48,000 a year. Senior citizen fighting cancer. With this plan, he pays $3,600 a year. There's a lot of difference. This is for people. It's for people who really need the help. And he's mischaracterizing it. And you know what? His good friend helped write it. And we'll tweak it and we'll make it better.
Thank you. I want to remind everyone to please keep your applause and outbursts to yourself. It would make this forum a lot more appreciable for everybody so we get as much time with these candidates as we possibly can today. Thanks. Senator Burns, your first answer to this question. In 2001, the federal debt was $5.6 trillion. Today it is $8.5 trillion, with foreign governments holding much of that debt. How is this situation affecting the U.S. today and in the future?
It's of a concern. It's of a concern. But you grow out of it. And the economy continues to grow. I think whenever this budget this time, it come in and they said it was going to be about $500 billion in a deficit. It's going to be less than 3 because the economy continues to grow. Here in Montana, our economy continues to grow. We got more people owning their own homes now and working than in the history of the state. Our GDP is up. And so we'll grow through it. But as far as our debt to asset ratio, we're still lower than we were, say, during the Reagan years. We're still within that margin. And I will tell you, we got to win this war. We didn't have Katrina. Katrina cost, and the economy of 9/11 cost this country. It was a terrible loss. In fact, you can't even fathom how much it crippled our economy when it happened in 9/11. We're just now getting through that. Do you realize last year was the first year that we got back to boardings on airlines what they were prior to 9/11? That's where you've been. And that's the impact that it's had on our country. And we will grow out of it because the economy continues to expand. More people working, new jobs, different jobs in new directions. That's pretty darned exciting. And our deficit will be a lot lower than forecast, say, just 6 months ago. Yes, it's a concern. You bet it's a concern. Because I got a granddaughter that I don't want to saddle with a lot of debt either. But we've always operated within the budget as demanded by the American people. And I thank you.
Mr. Tester.
I just want to touch real quick before I get into this debt thing because it's important. But the Medicare Part D, it needs to be simplified. Senator Baucus did come up with a plan to simplify it. You need to support that, Senator Burns. Also, close the donut hole so people get coverage for what they're paying for. And the last thing is allow importation for safe Canadian drugs, reimportation. I think it's the right thing to be doing. And if you're willing to do that when you go back, then I won't have to do it in January. The other point is that as far as the debt goes, you know, saying that the debt's only half as big as it was last year is like saying I'm maintaining my weight gain.